All right, let's learn the muscles of the head and neck. So just a reminder that on most of these models, you have superficial muscles visible on one side. On the opposite side, you'll see deeper muscles, and then some muscles are removable so we can see some that are even deeper. So starting over here, we have the frontalis that sits on the frontal bone, the temporalis that sits on the temporal bone, and the occipitalis that sits back here on the occipital bone. It's really nice. Remember, there are oftentimes named for the bones that they're associated with, or sometimes their actions or the regions that they're at. Now, we have this flat tendon that goes between the frontalis and occipitalis, and that's going to be your epicranial aponeurosis. Then we have the muscle that lets you blink your eye. That would be here, your orbicularis oculi. And if you want to make a kissy face, you can use this orbicularis oris that would go around the mouth. Additionally, here, we're going to learn two muscles here that come down to the lips, and that's going to be the zygomaticus minor and the zygomaticus major. Additionally, we have this risorius that comes across here from where we have the masseter all the way to the lips. And then deep to the risorius is this buccinator. Now, these three right now are kind of obscured by a bunch of nerves on this model. So if we look over on this model, we can see a little better that masseter, and we can see that risorius, and then that deep buccinator right there. If I continue into the neck, we've got our platysma. All right, and then coming down here from the sternum all the way up to the hyoid bone is going to be your sternohyoid. And then here from the sternum down here up to the thyroid cartilage of the larynx, on this side and on this side, you can see the sternothyroid. We also have our sternocleidomastoid, so from the mastoid process of the skull down to the sternum and clavicle. Now, if I take this off, you can better see that sternothyroid right there, and then we can also see our omohyoid. All right. Okay, so I have moved the model so that we can see those muscles now deep in under the chin. So right here, coming along here and then coming back to here is the digastric. So this would be the posterior belly of the digastric. This would be the anterior belly of the digastric. This muscle that sits underneath it that goes across this way, this little one right here, that's the mylohyoid. Note that a lot of those muscles go to the hyoid bone and have hyoid in their name. Then right here, this one that comes up here from the styloid process of your temporal bone and then comes right across the middle of that digastric, this is your stylohyoid. So from the styloid process of the temporal bone all the way to the hyoid bone. All right, back to this model standing upright. Remember that we can also see the pectoralis major on here. We can look under and see the pectoralis minor, the internal intercostals, the external intercostals. So internal and external. We put that back on there. We can see our deltoid, and then we have our trapezius. Now I'm going to move this trapezius off for a moment. And we can see some muscles right in here. These are our scalenes, okay? If I turn this model around, we can see this levator scapula coming down here. We can actually see the rhomboid minor, the rhomboid major, and we can even see the supraspinatus and infraspinatus right there. So we're going to look at those again on other models, but I thought I'd show you that they are also on here. And now I have put the trapezius back so you can see all of that trapezius. And again, we'll look at that on another model as well.